Okay. Hello, everyone. My name is Matthew Linton from the Council of Graduate Schools, and I'd like to welcome you to today's webinar, Mitigating the Caregiving Burden Among Graduate Students, Policies, Programs, and Practices. So before we get started, I'd just like to cover a couple of webinar logistics. The first is a reminder to please submit questions at any time through the question and answer feature in your Zoom toolbar. We will only be answering audience questions during the designated Q&A period, which will be following today's presentations. As always, the recording and presentation slides will be emailed to registrants, as well as posted on the CGS website after the live event. We usually try to do that within 1 week of the live event. So our plan for today is that we're going to have 4 speakers who will speak for approximately 45 minutes total, followed by audience Q&A. The first speaker will be Janet Gao of the Council of Graduate Schools, who will present highlights on caregiving burdens from the RAPID convening for approximately 10 minutes. Her presentation will be followed by 3 graduate deans, Michael Solomon from the University of Michigan, Chevelle Newsom from California State University, Sacramento, and Rena Bristol from Alabama State University, and they will discuss how their respective institutions have codified accommodations and support for graduate students with various caregiving responsibilities. And so with that outline, I'd like to turn the presentation over to Suzanne Ortega, President of the Council of Graduate Schools, for the introduction. Suzanne, the floor is yours.
Thanks so much, Matt. And colleagues, it's really great to have you with us here on this Wednesday. I think as many of you have done, my reflections on what the last 18 to 20 months have taught us about the impact of COVID and this era of racial reckoning is that in many ways, both have simply exposed long-standing tensions in our system. While it certainly has created new opportunities, it has amplified those tensions and given them visibility. And to me, this is clearly the case in the arena of exposing the impact of disproportionate burden of care shared by women and persons of color. And I think it also has amplified what I see as another trend coming from our students, and our colleagues, in fact, a deeper thoughtfulness about the appropriateness of work-life balance. So I absolutely am grateful to my CGS colleagues, research colleagues, and support colleagues for their work on our NSF-funded project, and certainly for the logistics of bringing together that knowledge plus the expertise of our deans to you, the CGS community. So without further ado, I'm going to turn the panel over to Janet Gao to get us started.
So thank you, Suzanne, and good afternoon, everyone. This is Janet Gao. I'm the Research and Program Associate at the CGS. In the next 10 minutes or so, I would like to present some of the highlights on disproportionate care burden among students from the RAPID convening. If we can move to the next slides. On June this year, in collaboration with Council of Historic Black Graduate School and Council of Opportunity in Education, we hosted a 2-day virtual convening, which is part of the NSF RAPID supported project. Here, I would like to acknowledge the National Science Foundation for providing grants to support this project. So the purpose of the convening was to serve as a platform for the graduate education leaders to compare, discuss, curate some of the emerging evidence-based practice and approaches to mitigate the adverse impacts of the COVID pandemic on the URM graduate education pathway, particularly in STEM fields. There were around 50 participants attending the convening, comprised of graduate deans, McNeil Program Director, and other campus stakeholders, as well as representative of COE and additional CGS and CHBGS members. We facilitated 4 panel presentation discussions, each followed by small breakout sessions organized by 4 themes, which were identified based on the quantitative and qualitative data that were generated from the underlying NSF RAPID survey conducted last summer. The webinar today will mainly focus on one of the themes, on mitigating the disproportionate caregiving burden of graduate students and policy and student support program that allow students to remain engaged with their graduate program. Continue with our next slides. Again, our discussion questions at the convening were mostly based on the quantitative and qualitative finding collected from the prospective and current student and program directors last summer. First, we asked, how have caregiving responsibility either for young and elder dependents impact the ability of a student, especially those from traditional underserved backgrounds, to pursue and continue their graduate studies? We asked participants to provide some of the example they have heard from current and prospective graduate students. Second, what and where might be potential opportunity for college and university to do more to support students with caregiving responsibility. We asked participants to provide some of the example of policy and resources their institution program offers to students with caregiving responsibilities. So we took the notes during the convening. We summarized a set of concerns as well as the strategies and tactics needed to implement promising practice and policy that will help support a diverse and inclusive pipeline into and through graduate program. So I've outlined those points on the next slides. At the convening, participants reported concerns over a disproportionate caregiving burden that impact the ability of the students, especially from the traditional underserved backgrounds, to pursue and continue their graduate study. Specifically, we heard that first, the limited caregiving resources accompanied by increased mental stress during the COVID-19 have negatively impacted student decision to pursue graduate education and have created difficult study-life balance for current students. We learned that historic underrepresented students and female students were especially vulnerable. Second, graduate students who are also essential workers have to gain extra hours that may otherwise be used on their study, especially for those whose family member experience job loss. The stress caused by this factor, accompanied by the lack of on-campus childcare, have posed challenges on time management for asynchronous learning experience. We also heard the worries about technology and lab access, quiet study space, regular mentorship, and continued funding, which have led to ongoing stress over the timeline for degree completion. Another important takeaway is that students wear many hats during the pandemic, and the different roles they played are irreconcilable. So for students, there are new moms, single parents, or parents with multiple children. The challenges surrounding the childcare were multiplied. So what can be done or has been done to alleviate the concerns? Let's move on to the next slides. So to alleviate the concerns, institutions agreed that they could or have been doing more to support students with caregiving responsibility. For example, we heard that number one, communication is essential. So some of the strategies, including, for example, outreach to students who experience challenges. This may help institutions to assess, identify, and leverage needs and resources. Also, creating office hours, especially for students in rural areas, so they have safe spaces to connect and engage with graduate school and faculty members. We also heard that foster peer support group appears to be beneficial as it provides accessible student support system. It provides students an opportunity to know other students with similar responsibility. The graduate parent support by the University of Alabama and students who are parents by Texas State University are the two examples of how institutions offer policy and resources to ease pathways for students who have caregiving responsibilities. In addition, for students who relied on technology access and quiet study space, it may be useful for the campus to expand the Wi-Fi access or provide possible device and space on campus for them to conduct their work. Another interesting suggestion we learned from the participants is that virtual spaces could be normalized and intersected with life and home. Many said that simple solutions of going virtual won't meet students' needs. Institutions can create a more inviting virtual supportive environment by engaging family and children as part of some of the virtual spaces. Participants also discussed that when students return to campus, institutions should consider reopening childcare centers on campus, making Head Start program available to eligible students, and exploring weekend and evening option for doctoral students to accommodate their family work obligations. Moreover, similar to the findings from the RAPID survey, continued and sustainable funding, especially through teaching and research assistance, are crucial. Last but not least, reducing the structure barrier, for example, preliminary exam that we used to think of as prerequisite for success, can perhaps encourage students who was discouraged during the COVID-19 to pursue graduate schools. So above are the overarching highlights from RAPID convening regarding how we can support for graduate students with various caregiving responsibility. Next slides. We are very fortunate and grateful today to have 3 graduate deans join us as the panelists. And they will discuss how their respective institutions are making different types of resources available to help students to find a healthy balance between continue their graduate study and to support their loved ones. There are Mike Solomon from University of Michigan, Chevelle Newsom from California State University, Sacramento, Rena Bristow from Alabama State University. So now I will turn it over to Mike. Mike, the floor is yours.
Great. Thank you very much, Janet. Really delighted and happy to have the opportunity to address this community today about an extremely important topic. And thanks to CGS for creating a space for these really important conversations. I will talk a little bit about our approach at the University of Michigan to caregivers that involves a number of supports that we've had in a sustained way, but also were available during the pandemic. And then also at the end, talk a little bit, somewhat frankly, about some of the gaps that we see and some of the needs that we're seeking to address, though this is still really an ongoing conversation and some of the supports I think are incomplete. I would also mention that, as you'll see as we move through, some of what we've put together over the years to support caregivers has been produced somewhat idiosyncratically. And I think even the CGS framework that we just heard about through the research is a little bit of a way for us to, after this kind of survey and census, to proceed a little bit more strategically in how we support this very important group, University of Michigan, but also nationally. Next slide, please. So before I begin, just to give a little institutional context, we are a large state institution with very large graduate and professional programs. There are 18,000 graduate and professional students at the University of Michigan. I'll be speaking today from the context of the graduate school. The graduate school is the home to research-based graduate students at the University of Michigan. So that would include all doctoral students, of which there are about 5,500. And then slightly more than about 3,000 research-based master's students. So although some of the supports that I'll speak about are available across campus, the Rackham Graduate School and some of the supports wouldn't extend to things like MBA programs to the law school, and instead are focused on research-based graduate students. So within that context, there's about 100 master's and 100 doctoral programs at the University of Michigan. And one thing I think that has really helped our thinking about this work is just to understand who caregivers are, or who graduate student who our parents are within these research-based programs. We've been pursuing a longitudinal-based survey of all doctoral students at the University of Michigan for the last 6 years, in which we've been learning about their progression through the degree. We now have our first cohorts that are graduating. And along the way, we've been able to learn a fair amount about the circumstances of our graduate students. And we estimate, based on responses, that we have about 200 current students in the graduate school, master's and doctoral, or excuse me, this would be doctoral, 200 students, doctoral students who are parents. So that's about 3 to 4% of the total. And it does help us think a little bit about how to go about supporting this group, because sometimes some of the supports we can offer actually are within our means, because They have a very strong impact on a small group of students, and they don't actually cost us that much. And so the last thing I would just say is the graduate school's role here today is we're the Center for Graduate Education on campus, and we also provide a number of the broad support programs for graduate students across campus that I'll describe today. My remarks will be kind of grouped into three categories for caregivers. One would be support that we would think of as benefits. So this will include the child care subsidy. The second would be supports around academic policy. And then the third will be kind of structural and programming supports. And I'll conclude then with a brief discussion of where some of the gaps are in some of our pilot and potential future programs. Next slide, please. So I think our main benefit, which is extends to all students on campus, undergraduates and graduate students, and is administered by our Office of Financial Aid and funded through the financial aid budget, is the child care subsidy, which is based on financial need, but is available to all students, domestic and international. Eligibility is through filling out, through demonstrating financial need. And it provides on a per term basis, support for licensed childcare. And the amount that is offered is on the slide, and it varies by the number of children that are under care. You can see the utilization of this, and now these are numbers that are specifically for Rackham students. So these are terms of utilization. A doctoral student would be eligible for 3 terms, for fall and winter term, and then also for spring, summer, just because of the nature of their engagement in research and education year round. The amount that is received per term is about $3,000, and I would say there are a number, here we don't have unique individuals, we have terms of support. But I think you can, we know from experience that many students are receiving this support term by term, and that if you look at its uptake, certainly more than half we expect of Rackham doctoral students who are parents are taking advantage of this subsidy. So it's a very strongly used support. It makes a big difference in terms of the funding that students are receiving to continue their education. Next slide, please. The other benefits I would just say, I think this maybe would go without saying in this case, but is the benefits that are received through employment and fellowship. And so just to make sure that this kind of floor, a very important support is identified, our doctoral programs are fully funded, and that students receive stipend, tuition, and also benefits. And the grad care benefit that's available to fellowship recipients, to research assistants, and to GSIs, to graduate students, does include coverage for prenatal, delivery, postnatal, and well child care. And so I just wanted to make that point as well as an important benefit support. Next slide. So the next is switching to academic supports. There are 2 that I'll address in turn. The first is our leave of absence policy, and the second is our parental accommodations policy. Leave of absence policy is broadly based. It has a number of categories that vary from a personal leave through to service in the military, but it includes a family necessity category for receiving a leave from enrollment from active time student status for up to 2 years. And so this is if an individual who is due to reasons of family need needs to step back from their studies, this provides a mechanism for that to occur and for them to be welcomed back into the program after they return from their leave. And so about 15 students per year take advantage of the family care leave of absence, and that includes caregiving as one of the categories of eligibility for that leave. Of those individuals, about a third receive leave for 1 term, a half for 1 year, and then the balance would be longer, up to the 2-year limit. I should mention that during the leave of absence, you're not an active student, you're not making progress to your studies, though you're welcome back as an active student after your leave. One thing that we have done in partnership with our great partner on campus, the Center for Education of Women, CEW+, is to work such that health insurance fees that will carry over during this period are offered to students who are experiencing financial hardship and are taking advantage of this family care leave policy. This, we believe, improves outcomes for students and completion, because it provides a regular mechanisms for students to pause their studies with supports of their program, and then have a mechanism to very clearly allow them to rejoin and make academic progress. Thanks. Next slide. And then the parental accommodation policy relates to, this would now be paid or active student ability for students to maintain their status due to the birth or adoption of a young child. And so the time for this is about 6 to 8 weeks, and this is eligible to all students and to all Rackham students. It also adds an additional year to the normative time degree, which is already really very flexible at the University of Michigan. And so this provides a within semester benefit or academic support for caregivers. Thank you. Next slide. To conclude then, starting to think a little bit more about supports that are structural and programming in nature, is to mention our travel grant program. So this is very recent. It's been used by a small number of individuals for graduate students for reasons of professional development and academic progress, presenting a talk at a conference. This provides up to $750 for those individuals to bring their young children with them and to take advantage of child care services, for example, that might be provided by the conference and receive reimbursement for that, and also for travel expenses. We have a comparable program for postdoctoral fellows as well. Again, these programs we receive about 25 applications per year. This is a very welcome program for individuals that are taking advantage of it. And we think that it doesn't cost us that much and is really an important support that we've developed in recent years. We also have emergency funds that have been available that have been flexibly used during the pandemic. Next slide. And finally, just to talk about some additional programmatic supports, and I think this is also a wellspring of new ideas that are coming in. This is all in partnership with CW Plus, who I mentioned earlier. We have a resource page that's been provided to help students access resources. We have a working group that's comprised of individuals from the graduate school on campus and from CW Plus that is really trying to work at this from all angles to try to, especially during the pandemic, to try to identify what student needs were and address them to the extent that were possible. And we're also in contact with graduate student organizations that are independent, the Graduate Student Parents and Caregivers Group, so that we're sure that we're receiving input from them and in contact with the needs that are being identified. We've also been conducting a research survey to try to learn more about needs, and we host a Facebook group as well. And the last slide then is to just think about where some of the tensions and needs and gaps are and some of the things that we're doing to address them. One thing I would say on our campus is, and this relates to the pandemic, is the availability of support for unlicensed childcare is a topic that's somewhat contested on our campus. And it's related to the fact that our childcare subsidy applies for licensed childcare. It's a long-standing nature. During the pandemic, licensed childcare was in short supply, and so there was a change in the subsidy that was made under certain very limited circumstances to allow access to unlicensed childcare, and that has since ended. And so I think that's an ongoing conversation at the University of Michigan. As the availability of that. But as I did mention, even the licensed childcare subsidy is very highly utilized. Then briefly, we've been trying to make use of the standard academic notifications process. That this might be used by student parents that encountered unexpected obstacles to, for example, attending a class or some interruption in their ability to participate in a class. We've under discussion would be, these are now ideas and express needs, priority registration, reserve spaces for student parents at childcare centers, and a possibility of a syllabus statement. So with that, let me conclude. And the last slide just says a thank you. And if there's, I'll be looking forward to the question and answer later on in this webinar. Thank you. Maybe I'll turn it over to my colleague now, who needs no introduction. Please take it away. Thank you.
Hello, my name is Chevelle Newsom, and I am the Dean of Graduate Education at Cal State Sacramento. And I want to, next slide, please. I'd like to thank Suzanne and the group at CGS for their leadership on this issue, and tell you a little bit, start off telling you a little bit about our campus and our approach to helping graduate students who have caregiver responsibilities. At Sacramento State, we have a student population of a little over 31,000, and about 8% of those are graduate students. We are an HSI, an ANAPZ, and an MSI. We are also a TRIO campus with a McNair Scholars Program, and we pride ourselves on diversity and inclusion. It's one of our major imperatives that our president launched about 4 years ago. And I want to spend my time today talking with you a little bit about how we approached it when you are on a campus where you are a small graduate percentage of the population compared to undergraduate populations. We have a demographics on our campus where, if you can see on the slide, about 45% of our students are from the BIPOC communities. However, that percentage is largely in our College of Education. It is not across campus. And so the understanding of our students from BIPOC communities and their needs as caregivers is disparate across our campus. And so I want to talk to you a little bit today about our institutional approach to doing that. Next slide, please. We knew that in order for our students to have the kind of support that we would want, particularly during the pandemic, that we were going to have an emergent and an adaptive system from a university perspective. We also know that students with caregiver responsibilities, students who are from BIPOC communities, feel a pressure to conform to traditional student needs and often have trouble speaking up and providing feedback for their needs in order to progress through a degree program. We know that their needs are different, and we also know from our standpoint in the graduate college that we have to support and get buy-in and support from not only the graduate community, but the larger university community in order to support these students. So we knew that tapping into that framework was going to be essential. We knew that we had to have a developmental approach for our faculty and staff that were working with our students so that they could understand their needs. So we started off with a survey of our students during the pandemic to identify what were their needs, what were they struggling with, what were the things that we could support, and how we could scaffold into that institutional framework of support for our students. So next slide, please. Using our survey of our students, where we asked them, what are the things that you feel you need to help you through the pandemic? We began our conversation on our campus that was grounded in our mission of inclusivity. And using the president's imperative of diversity and inclusion, we looked at our graduate student population as a group of students who were not a part of the mainstream, which is predominantly on our campus being undergraduate. And how could we start a conversation regarding supporting this group of students on our campus? And so in order to build that conversation, we asked a question of faculty advisors, graduate coordinators, department chairs about students in their programs. And we asked, were they a part of the legitimate graduate community? And so of course their answer was yes. And so then we began to share with them what the concerns and the needs were of this community of students. We talked about how the lack of services were impeding the support for academic progress for these graduate students with caregiver responsibilities, using the survey that we had conducted as evidence that the students were telling us this is what they need. And then we talked to particularly our graduate coordinators about how we could implement a network of services to support students, to offer them an array of services, whether they were caring for parents or they were caring for an elderly family member. But how could we build a web of support for these students? Next slide, please. So based upon that, we knew that we had a CARES office on campus, and our CARES office handles case management. It handles students who have particular services and needs. And prior to the pandemic, graduate students were not fully included in the CARES office. There were emergency grants that students could apply for, but they weren't on the radar of there being a need for students, graduate students in particular, for needing their support and services. So our CARES office has a mission to provide services and support for students and help them connect with various services on campus and in the community that can help them maintain their academic progress to a degree. And so we did some partnerships with the CARES office. And one of the things that the CARES office identified to my office is that they really needed more financial support. And so the onus of how do we provide that additional financial support fell to me to work with our advancement office to talk about what are ways that we could build more support for the CARES office so they could expand their services to support graduate students. And so this advocacy for resources for graduate students in terms of emergency loans and grants, and in terms of healthcare and other things like that, came out of the need to support students with caregiver responsibilities who during the pandemic were actually having reduced hours and other things and had greater fiscal needs. So that was one partnership that we did, and we've institutionalized, and the advancement office, our fundraising arm and fundraising arm of the university, has really partnered with that office to provide services and support for students. The second avenue that we worked on was advocacy. So we worked with the faculty governance offices to establish an excused absence policy. Our campus does have a leave of absence policy, which all students have been able to take advantage of, but they didn't have an excused absence policy. And what we learned during the pandemic is that sometimes our students, because services were being cut during the pandemic, there weren't ride shares, there weren't other things that they could get the people that they were caring for into. So they had to take on that responsibility themselves. So if they had a loved one who needed dialysis, they had to take the person because there may not be a ride share available during the pandemic. So what we did is we worked on getting an excused absence policy so that the student didn't have to explain or negotiate or cajole with a faculty member. There was actually an institutional policy that supported the student in knowing that with an excused absence, they could step out and take care of their family needs. It wasn't something that they needed to have a leave of absence, a leave of absence for, but it was something that they could use the excused absence policy for. And then the next thing that we did was we worked with presentations to the executive leadership team, both the president's cabinet as well as our board of trustees. And we shared with them the needs of graduate students with caregiver responsibilities to gain an expanded support system and also to expand the university's mindset regarding graduate students with caregiver needs and how we could support them and ensure their progress toward a degree, particularly those students who were in STEM disciplines and who had internships and other areas where they needed that additional support and time. Next slide, please. So as I said, to operationalize the plan, we were knowing that it was emergent, knowing that it had to be collaborative. We worked also on a continuous enrollment policy that allowed students to be able to not necessarily step completely away from their studies. Maybe they just needed to take a gap, but they still wanted to have access to university services. So we provided a continuous enrollment process that allowed them to have a buy-in to if they wanted to keep their health care, or a buy-in if they wanted to continue to use university services like the library that were just minimal cost outside of the framework of regular tuition that the students had to pay. And that was one of the things that the students said was really helpful to them. So we knew we had to be collaborative. We knew that it had to be low cost for the students as well as low cost for the institution to be able to support it, given our financial situation. And then also we wanted to include faculty and students in the discussion. And so we have continued to have conversations with faculty about how policies are affecting or working, so that we can also then communicate to students how best to communicate with faculty, what their needs are, and also to communicate with us in administration about how to support them. So the challenge is that this is slow. And that is incremental, but operationalizing the plan from an institutional perspective, I think, has really benefited the students. So next slide. I want to talk about some of the programming specifically that came out of our support for students. One of them is a partnership with our associated students with healthcare providers in the local area that have resources for caregiving and parenting resources specifically adapted for students. And our graduate students have really expressed their appreciation for this online service, particularly during the pandemic, but also as we're coming out of the pandemic, having access to this care, being able to actually go see people face to face as well. The other thing that we did was in academic services, we have pre-service teachers who needed to get instructional hours in. So our academic services colleges built a tutoring system for our students, which was a great benefit to our graduate students because, as you know, during the pandemic, they were trying to educate their students at home as their students were doing remote instruction as well. And so this tutoring system was set up. If you had a student who needed help in math, that was the big area to stop slippage in math. If your student needed help in math, a graduate student could sign on with like, my student needs middle school math help, or my student needs support with lower division, K-12 support, K-6 support for mathematics. And there were hours set up during all different times that they could sign up their student for and to get support. And that was a major success, I think, story for our students. And then finally, there was some peer-to-peer support. Our graduate student club wanted to know how they could support their peers. And so they created a story time where graduate students could sign up, particularly during the pandemic, where they just needed like 15, 20 minutes to just cook dinner or fold up a load of laundry. And so they created a story time for our smaller tot children, preschool age, and students could sign up to just have their students be read to and have that little support break time for them. And they really found that supportive as well. And so finally, next slide. So finally, what we have learned so far is that providing these interventions and responding to graduate students' needs requires social support. The students really, really liked the peer-to-peer interaction that they got from their grad student club and setting up the story times for their students. We know that we need to build capacity because our CARES office needs additional support resources because there are more needs from our students that are coming in than we have resources to be able to provide. And then finally, that physical support is essential to our students. The community resources and connections to folks in the community that can support them is important as well. So thank you so much for your time today and for allowing me to share with you some of the things that we're doing here to support in our graduate students. Next up, my colleague is going to present for you.
Good afternoon, everyone. My name is Rena Bristol, and I'm the Assistant Provost and Dean of the Harold Lloyd Murphy Graduate School at Alabama State University. I'm really so pleased to be with everyone today, and I'd like to kind of think one of these things is not like the other. Alabama State is a much smaller institution, but we're so happy to be here. And so our motto around ASU is that we're helping graduate students one at a time. Next slide, please. For those of you that don't know, Alabama State University is a historically Black college located in Montgomery, Alabama. We were founded by 9 former slaves in 1867. So we've been in the business of educating African Americans for about 153 years now. And 75 of those years, we've provided graduate level education. Many of our students are first generation college students and first generation graduate school students. About 12% of our students are enrolled in graduate education, and 65% of those attend their programs full time. And most of those are in our College of Health Sciences and social work. And today, we of course started out like many historically Black colleges as a teacher's college, but our largest percentage of graduate degrees are now actually awarded in health sciences than in education. So come visit us, please. I also encourage everyone to come to Montgomery. Next slide, please. like many of you, we have a lot of campus resources for all students. And I'd like to reflect on a few of those that in preparing for this and talking to people to see what are those things that the students and the deans in particular most appreciate. So one of the things up in the upper left of your screen, you'll see just a space with tables and chairs. Our doctoral students in the education program call this their unofficial hangout, but it's more than that. This is where many of them have peer-to-peer support. Anecdotally, they tell us that they help each other out with childcare so someone can get work done. And there is, of course, a very strong tradition in the African-American community to help one another out. They really do believe and practice that it takes a village. And so they all work together so that everyone together will achieve their goals. And that's a very inspiring thing on a day-to-day basis. ASU as a whole is a very family-centered workplace. And I believe that it is fair to say that we extend those same graces to our students overall, undergraduate and graduate. So that's a really fine thing. We have a wonderful early childhood care center where our students can send their children for a very low fee relative to the cost of daycare in the community. Our child care program is currently suspended, which was a free program, but of course with the pandemic, that's just not really happening right now. We're hoping to reinstate that. We have, you see up there, a violence against women's program, which of course is very important. And most of us have some kind of Title IX type of space where that lives. But this office is actually also important to us because this is an office where the director will help us connect, and she's in student affairs, for students that need specific social support, access to social resources in the community. And so although the program is specifically targeting types of dating violence, et cetera, the director is very helpful for our students. You can see, of course, we have the full cadre of offerings from student affairs to help with grief, to help with anxiety. Those have really ramped up in the last 2 years. We've seen a lot of that. Suicide prevention and mental health, that's a very great concern. And so we always, our faculty are great at reporting students who are struggling. That is really a benefit of our campus, that everyone, all the advisors know their students very well. And if there's a problem, they report it. A new initiative, and I'm really excited, is in the upper right. Our undergraduate Bachelor of Social Work students are doing, or just did, a spa day for the students in the Master of Social Work. They recognize that those students are going above and beyond. And so they took care of them. And we really thought that was a beautiful expression. And we're very proud of those students for seeing that. And hopefully they will continue to support one another as the bachelor students become graduate students in the master's degree program. Some other things that we do here, and you've heard others talk about this, through our advancement office, we also have the availability to get emergency funds for students who need them. All they have to do is tell us what it's for, and we will actually pay the individuals directly if it's possible. We are very flexible with extensions of time for all students for whatever reason. If someone starts running out of time, it doesn't take much. We understand especially when it comes to caregiving. We think that the history of shared childcare between the students is actually one of the great strengths, that when students come to our campus, they're just never going to be alone. And that's been going on for a very long time. And that has been really helpful. We're also a campus that if you need to bring your child to class, no one is ever going to make you take that child away. Everyone is going to work with you. So we really pride ourselves on that family atmosphere. One of our university programs is called Communiversity, the community and the university coming together. And so our graduate students benefit from this because, again, if there's needs that they have through our Communiversity program, we can get them access to resources. Often many of our churches are willing to step up and provide help. We, like all of you see on the screen, a resource room, which is both a food pantry, a place to go get questions answered if you need clothes for an interview, and all students have access to that, of course. And so Student Affairs just does a fantastic job at all of these kinds of programs. Something we've also learned as a campus and as a graduate school through the pandemic, I don't think it's a lesson that many of us haven't figured out, is that as often as possible, our graduate students, even the full-time on-campus students, like to have some flexibility in modality and delivery of their courses. So as much as we can give them online, they do appreciate it, so that they can be at home and do their work and monitor their family and work with their many, just all the other caregiving burdens that they may have and responsibilities. It's not always a burden. I shouldn't have said that. An unintended consequence also, as well as from all of this, is suddenly the deans on our campus understand the importance of maybe developing 4+1 programs for our students, so that they will continue and have an opportunity, a better chance at going to graduate school, and also utilizing the senior privilege options more effectively to do that. Our Graduate Student Association is very active, and they're right now planning on how can we create some opportunity for the students to meet with one another face-to-face, just in peer supporting, to expand their peer support. They already do a lot, but coming out of the pandemic, that's something they're very interested in. Next slide, please. I thought I'd just give you just since it's one student at a time on our campus, it's really led by each college. And this is, I think, a great example of a case study on our campus. Our College of Health Sciences, as I said, graduates probably the most students right now. And their approach is both cohort and individual, which is really wonderful. I think the core of everything they do is really Maslow. The Maslow hierarchy, you all have seen this before. They make sure in that college, from the application process all the way through graduation, that students have all of their basic needs met, including childcare. They know more about their students probably than anyone else on campus in terms of caregiver, commuter status. They ask their students when they apply, when they are doing their scholarships. So when they take them in, because of the heavy duty clinical requirements of the programs in this college, they want to make sure that the student has everything in place that they need to succeed. And they have social events, they have check-ins. You'll see on there's a flyer, there's an event coming up. They just actually sent this out for our rehabilitation services program. They're going to be doing this. They've been working very closely with the clinical sites to help the students during this COVID, which is still, of course, an issue for them, in case if they have a child that gets COVID. So there's the clinical sites have been fantastic, working with our students to make sure that they get the clinical time that they need so that they can pass their classes and then in the end pass their licensure exams. And the outcome of all of this is that right now they have a 97% pass rate on the national licensure exam on the first time out. So what our College of Health Sciences is doing is working for our students. And that is the end. You can advance the slides. Thank you, everyone, and I look forward to all your questions.
Okay, well, so now we're going to move to the Q&A, audience Q&A portion. So if you have a question for one of the panelists, please put it in the Q&A box in your Zoom toolbar. We'll try to get to as many questions as possible. So this is a question for everyone. So why don't we start with Mike, or to all the deans. Do students need to be enrolled full-time to be eligible for funding and support?
Yes, thanks. Happy to answer that question. The answer is a little bit complex. Let me start with the foundation, which would be, for example, for the childcare subsidy that we offer. That is requires half-time enrollment. However, the additional piece I would say that for doctoral students, we do have a continuous enrollment requirement, and there's a kind of there's a little bit of an implicit assumption of full-time status in that, and so I think I think for the reality for many caregivers who are pursuing their studies, particularly doctoral students, there is an assumption of full-time enrollment, and that's a challenging issue for us. But formally, that child care benefit is available for half-time. Thanks.
Is that also true at other institutions? Chevelle, do you have anything to add?
Yeah, I was just going to say, we created our continuous enrollment as a bridge. And so what we try to do is have our students enroll in continuous enrollment and then try to find a way to meet the requirements for them for enrollment status. And so, yes, it's supposed to be half-time, but we try to use the continuous enrollment as a stopgap to help support the students.
At Alabama State, in particular for emergency funds, as long as you're enrolled, we are going to try to help you.
Great. So we've got another question for all of the deans. Have you looked at the utilization of short and longer term leave policies by department? I'm wondering if graduate students in laboratory-based research degree programs feel they're not able to take advantage of the leave policies due to fear they may lose their project or spot in the lab. Chevelle, I see you nodding, so I'm going to go to you first.
Yeah, it is a challenge for our students who are in the lab sciences because they do feel the pressure, but our dean for our science program has really worked hard with the faculty and the department chairs to try to support students. We have an educational equity science program, and so I think a lot of times the students will get funding from that if they need to extend their time so that they have a little bit more leeway and they don't feel so much pressure to leave when they want to. But it is a real feeling for the students, and so we try to mitigate that as best we can.
Mike, I see you nodding as well.
Yeah, and just to add to that, this is a place in which our consultation services can be very helpful. So we have a resolution officer who can work with the programs, and our resolution officer has the backing of the graduate school in the sense that the leave of absence is required, and there must be an on-ramp back into the program. So the student cannot lose their spot in the lab or cannot lose their spot in the program. They must have a plan to return. Now that's the formal policy. I could still understand that students might, just because of the informal nature, like be unwilling to step forward, and that's where then the resolution officer can help by mediating that pathway with the program itself. So it is a little bit complex, but I think it requires interaction between academic policy and like a resolution officer.
Yeah, we don't have many of these, but and our main lab science is in the CSTEM, and the program works with each student on a case-by-case basis with the graduate school, and we have a procedure that we follow to document and make sure that we can help the student. We have a student right now who stepped out this semester, in fact.
Great. I've got a question for Mike from Daniel Kleinman. Asks, what do the syllabus statements say?
Yes, that's so one thing I should say about the syllabus statements, that is definitely a future idea. So that's not anyway a campus, not only a standard, but even a common practice at this point. So an example though from a class of which I'm aware would be within the context of the university's commitment to D&I, recognizing a statement that would recognize the unique needs of student caregivers and inviting the caregiver to come forward to discuss accommodations that might help support them in the class. And then the other piece would be directing to this student resource page that Center for Education of Women, CW+, maintains, so that also even at the level of a syllabus, a student is aware of the resources that are available on campus. But maybe just to close, then to circle back to, this is not this is not by any means a normative practice yet. And I think one of our interests is to try to advance that possibility.
So we've got another question that actually I was thinking about people were having their presentations. So how are advisors being supported in your campuses? I'm concerned that my advisor does not have the capacity to aid my personal struggles because of their own challenges. So how are the caregivers, the front line, being given support on your campuses? Does anybody want to start?
Sorry. All right. I want a little clarification. If we're talking about how our faculty are supported or how the advisors themselves are being supported, we do have on our campus for both our faculty and our professional advisors, we have a program of support that's called well-being. And so the faculty and the staff on campus can take advantage of well-being. And so if they're having struggles or crises or need therapy, they can use that service on our campus, and it's actively available for them. And we do encourage them. And at all of my presentations, I remind them that, you know, we have to be healthy in order to help others. So put our oxygen mask on first. And so I promote those services to them as well, because burnout is I think a real crisis for some of our faculty and staff.
Yeah, that's the same. We also have a program for faculty and staff at Alabama State through Human Resources, linked to the Student Counseling Center. Actually, you know, we can also use those services. And the other thing, I think the graduate school staff actually are here to help the advisors as much as possible as well. We kind of take on that extra touch because sometimes it's the advisor doesn't have time to sort out a student's personal problem, but they know they can call us and we will help the students. So we try to serve as a backup for the advisors.
I'd just like to endorse everything that was said, and perhaps you know, this is a wonderful question that really identifies a gap. So I would think, looking at our experience, I'll give two examples. One would be caregivers here, but then also in the broader space of mental health and well-being. We've had a campus, a graduate student committee look at this. One of their year two recommendations was actually to focus on faculty and staff mental health and well-being as a dimension of supporting the well-being of students. It was a very interesting recommendation. And so there is a campus-wide committee that's looking at this. But I think the pandemic really showed that this was an extremely difficult time for faculty and staff. And there's the set of services I think are not as large. Like there's some of the regular support, but it's hard to point to the array of services that, for example, we've been able to provide for students, I think.
So we've got time for one more question. Steve Wiley asks, a structural issue at my university is whether graduate students employed by the university as TAs or RAs are considered employees or students for the purposes of benefits. Do other universities have this distinction, or are graduate students treated as employees, as in equal to faculty and staff, for the purposes of benefits? We want to lead with Rena. Do you want to take this one on?
We don't have that structure at our university. All of our students are just graduate assistants in the traditional sense. But we have very low cost student health insurance, and they have all those. One of the slides, I think it was yours, Chevelle, that talked about all of the, or no, it was Michigan's. Our students have access to all full childcare with their full range of services that we would get through our employee healthcare. And that's true for all students on our campus.
I'm happy to jump in briefly. This question does resonate with me. I often speak about our doctoral students in particular as having a unique role in the university as both students, employees, scholars, instructors, researchers. And so we do work hard to the extent that's possible to harmonize among the different categories. So for example, the grad care that I spoke about is a graduate student specific health plan that is available to employees and students alike, to graduate students. And that's just one example of ways in which we try to actually not make the distinction and you know, as to not have that be a large distinction, so that we really can view that as the integrated role that they play. But it's definitely something that we keep an eye on so that there's not drift within the different kinds of benefits.
So I'm just going to squeeze, oh, unless Chevelle, if you want to go. Okay, I was just going to squeeze one last question in here, thinking about the future actually for Janet. How can we support thinking through or anticipating the needs of prospective students in the caregiving realm? I'm thinking about the next generation. Janet.
Yeah, is that for me? Can you repeat that one more time?
Yeah, how can we support thinking through and anticipating the needs of prospective students in the caregiving realm?
Well, that's a question which would not be able to answer in a minute. But I would say this is what we have been doing. We're trying to figure out the framework that produced from the convening as well as the RAPID survey we have been doing in the past year. We're hoping to come up with a framework that could be applied to institutions, then also based on the different contexts institution can apply to their own policy and practices. So this is a very broad questions, and we're working on that, and we're hoping to produce something that could be generalized.
Well, thank you so much to all of you, to our Dean presenters, as well as Janet for her great presentation. I just want to alert folks to an upcoming event. That's the CGS 61st annual meeting from December 1st through 4th at the Sheraton New Orleans Hotel in New Orleans, Louisiana. We hope to see many of you there. And a quick reminder, I just got a couple more questions that we weren't able to get to. We'll try to align those questions with speakers as much as possible. And remember that we will be sharing this recording as well as the presentation slides with registrants. So if you really got a lot from the slides and recording, that will be available to you. So thank you all for joining us. Thank you to the presenters for all their great work. And we look forward to seeing you at the next CGS webinar. Have a great day.